So I've talked about how avoidance, both in behavioral avoidance and in cognitive avoidance, both of those things can maintain that anxiety. Well, let's talk about how we can actually treat it. So there's a couple of different treatment options. All of them surround them with exposure. So it's exposing somebody to the fearful object or event. One of these is called systematic desensitization. So let's pretend that somebody is very fearful of giving a presentation in class. Actually, this is the number one fear among a lot of people. So oftentimes what we do is we give children this fear thermometer. How scary is it and how fearful are you to have to do these different steps? So giving a final presentation in class might be a 10 or a 10 plus for a child. However, identifying a topic might be like at a 2 or a 3. So what we do is we start at the bottom of this hierarchy and we work our way up. So what we try to do is desensitize a child to the thought of the presentation, to the actions of the presentation. And we're trying to pair that, the fear things with relaxation. So if I am now calming down my breathing, right? If my heart rate is going very fast, I'm breathing very fast. If I start to relax, that will hopefully improve that heartbeat. That'll hopefully make it easier for me to breathe. A second one that we often use is something called the coping cat. So this is based off the coping cat, which is a cognitive behavioral treatment for anxiety. So if you look on effectivechildtherapy.org, cognitive behavioral therapy is listed very highly as an effective treatment. So typically it follows in 2 phases. First is just education. So what is anxiety? What's the difference? What's our thoughts and our behaviors and actions, and how do they all interact with each other? And then talk about those coping strategies that we might have. So while a coping strategy is avoidance, it's not an effective coping strategy. It doesn't help us. Instead, we may start to develop coping strategies, one of which is called the fear plan. So if you first start to notice that you're feeling frightened, so you might notice your bodily symptoms that are happening. You may expect the worst possible thing to happen, not the best, but the worst, right? I'm giving a presentation in class. I'm starting to feel frightened about it. The worst thing that's going to happen, I'm going to get tongue-tied. People are going to laugh at me. I'm going to expect the worst. Oftentimes in anxiety, you don't expect the best, right? Even though they might have a likely outcome and likelihood. So you feel that way, you expect the worst, and you start to come up with attitudes or actions that can help. So some of that might be, an action might be deep breathing. That helps reduce my, that fear experience that I'm having. Or I can change my attitudes or my thoughts about that. So it might be changing my attitude. Well, other people also did this, and none of them threw up in front of the class, right? Or it might be, I've given presentations in the past, and they went well. So you might really want to think about that. Results and rewards. Since we're talking about kids, we want to reinforce their good behaviors. We want to reinforce them actually completing these, because that, right, it's scary to be able to go out and try to do a presentation. So you want to, of course, reinforce that behavior. So any time that they try, reinforce it a lot. Again, I keep talking about this selective mutism video, but in that selective mutism video, they actually do show you how to reward children for any little behavior, any little noise. The last little part about phase 2 is to actually take this outside of the therapy office. So practice using these different types of steps in different contexts, because we want that child not to learn how to not fear giving a presentation in a a therapy office, but we want them to learn how to do that at school, for example. So basically, yeah, go out and do this and keep doing it over and over again. The goal here is to habituate or reduce that anxiety after repeated exposures to the exact same thing. So somebody might practice if it is in a context where you're afraid of talking to somebody, you may just practice. Hey, I'm going to talk to the coffee shop owner, and I'm going to talk to the barista, and all those little things help you to habituate and help you to reduce that anxiety. So hopefully you learned a little bit more about how avoidance keeps anxiety going, but how once we use exposure, we can stop that avoidance, and that will decrease the anxiety. All right, have a good one.